The health and justice context really came out of my dissertation work, and coming into my PhD, I was really interested in addictions and mental health, and looking at, because I did a PhD in community and regional planning, I was thinking, being in Vancouver, it just made sense, right, to look at I was interested in the four pillars approach, and how it was interesting that Vancouver had, what was it called, the Vancouver Accord or something like that. And
That's right. Yeah.
yeah, and so all that, like, there was just this flurry of work that was done in the 90s in response to the first public health crisis, which was in the downtown east side, and there was a huge mobilization in response to that, and then it felt like it just kind of fizzled. And I really wondered what the impact was on Indigenous peoples, being as a third of the residents in the downtown east side are Indigenous. So in looking into that, I was thinking about this continuum of care concept, which is about wraparound services that you provide, such a strong safety net around somebody that, nothing's going to come out of that net. A friend of mine said, well, you should go and connect up with the Native court workers, because the Native court workers are really, trying to activate this continuum of care model. So that's how I started working with the Native Court Worker and Counseling Association of BC. And it's been an incredible partnership. And so they work with Indigenous peoples in the justice system. And it was a very nice connection for me to make, because I knew about their work. My dad actually was the manager of the court workers in Prince George years ago. And so I knew about their work. But what I didn't quite realize was how connected they were to urban self-determination and governance, because their work is across the country, and they came out of the Friendship Center movement. So the Friendship Centers started in urban centers, and they were actually originally intended to be places of assimilation. The federal government sponsored them and set them up because they realized increasing numbers of Indigenous peoples were coming to the city as a result of residential schools, a result of all sorts of colonial policies that were making life unsustainable on reserves. And there was really nothing for people in the city. So these places were set up, and they were intended to be referral centers. So they were to be referred to mainstream services and organizations. And of course, that didn't work. And the people who are working at the Friendship Centers, who are Indigenous, realized, well, we've got to create our own thing here. And so they did. And they did that through, through grit and determination and volunteer, because there was very little money in all of this. But anyway, so out of it kind of emerged this really interesting, unique, and very particular to the place in which it developed approach to urban self-determination, to supporting Indigenous people in the city. So I feel like, the Native court workers, their work is really kind of coming out of that ethos and really embraces that. And I saw them as community planners. And they have a health team that works there alongside the people who work in the courts directly. And so, that kind of, the way in which they're looking at health is much more than, biological health. It's really like cultural health and community health and well-being. And so their programs and their services and the way in which they do that work reflects that really what is an Indigenous ethos, this concept of what I describe in my work as relational accountability, right? So there's different types of accountability, and you have, when you're a healthcare worker or counselor, you have, you have accountability to the health authority and to other funders. Yeah. And the Native court workers also have those accountabilities, but they have an accountability that sort of goes a little step above, which I was describing as relational accountability. And how that gets expressed is through, the really going above and beyond. I mean, I guess is one way to to really quickly. I'm writing an entire article about this right now, so I can give you that that citation at another time. But but I think what it's really about is just understanding that that each person is a whole human being that is connected not only to themselves and needs their own individual healing, but is also connected to a family and is connected to a community and to a nation. And really, the work is about connecting all of those things up. And so you always welcome somebody back into the circle, no matter what, no matter what's happened. If somebody shows up and they're really upset, protocol might say that you need to get them to go away and come back once they've calmed down. But I heard counselors say, I will see that person. I won't try to counsel them. I won't try to give them anything, but I will try to, see what I can do in that moment.
Yes.
And that's a liability issue too. And other counselors, might not be comfortable doing that, but there's a level of accountability that recognizes that more harm could be done in the community to, if that person goes away. So there was just a lot of different examples like that I saw of this, ethos of care that, again, I think is really hard to encapsulate in a mainstream kind of service delivery system because it's just a different worldview. It's a different way of seeing people, and it comes from a different training as well. So a lot of the Indigenous counselors, they use culture, they use ceremony, they use different kind of, ways to connect with their clients that are based on their way of being in the world. And it's what connects the Indigenous clients and the non-Indigenous clients as well. So I think in a way, they're kind of working to sort of break down the silos, right, which really exist and are very, very strong. And it's what I heard over and over again from people, that a big problem with delivering care in the downtown east side, throughout the Lower Mainland, is just the existence of these many different places that you have to go to get all of these types of healing and wellness. And they're kind of trying to work to collapse that.
Yeah.